be Jerry Maguire for doctors. It's Ethan Incana.
Ethan, I think the one thing that you talked about, especially the like when you're negotiating or talking to like a larger group, like whether that's like a multi-specialty group or like just kind of a massive kind of corporation, and they're like, yeah, this is the standard for everyone. Like, you can't negotiate. I'd be interested to hear your strategies for that. And also, um, for when you're negotiating with places that have 100% of your salary is like RVU based or collections based, if they're like, oh, everyone gets 2 rooms, period, I feel like they could like limit your salary that way or in indirect ways.
Yeah, really great questions. And I think you bring up two situations that I often see it in practice with experienced docs. So let's go backwards. So I'm going to address your second question, and then we'll come back to how do you advocate for when they say it's a standard contract. So first, when it comes to volume-based pay, yes, there are going to be natural constraints. How busy can you be? How many patients you can see in a day? How many patients actually have access to you because of systemic issues? So there are certain things that physician cannot control, but the things that you can control. Generally, when it comes to volume-based compensation, there are two primary components. The target, which means sometimes they'll call it the threshold, but it means how much do I have to produce in order to achieve the bonus, and secondarily, your bonus amount. So you mentioned RVUs, that's usually $1 per RVU, or collections, which is usually a percentage of some dollar amount. In each of those situations, the things that you want to negotiate are one of two things, ideally both. Reduce the threshold, so the target that I have to hit to earn the bonus is lower, which means I hit the bonus quicker. Secondarily, increase the bonus percentage. So a lot of times when I'm negotiating a deal, they'll start the bonus percentage, at whatever number. I'll just use a silly number and say 40% of collections. And so what we'll say is, great, can we propose that the physician in years 1 and 2 get somewhere between, let's say 50 to 55%. And they'll probably say, no, but we can get you to 45%, right? So the goal is to meet somewhere at a happy medium. So from the volume side, those are kind of the controllables, understanding that the capacity and access piece, the physician may not necessarily be able to control. Does that raise additional questions? Does that get to what you were actually asking?
Well, yeah, I mean, I guess I'd be curious what the rest of my like co-residents think. I have never seen any sort of bonus after hitting like a percentage. It's always been like it's either like RVU based or percent collections straight. But I guess I'll have to look more carefully at that.
And it may not be that you've had a contract yet that has a percent of collections model. That's just one of the more common compensation models you tend to see in a private practice setting. So I'm not suggesting that you have to see it, but it is a fairly common one, so you might see it.